Things for parents. Check this out. 2.6 million days are missed. 2.6 million days are missed every single school year because one child, or obviously more than one child, but you know, there's no reason for a child to be in dental pain. So here's what we need you to do. Okay, so parents, first of all, 3 things. It's back to school shopping, right? Oh, thank you so much it's so nice to hear that we've got some other dental people on here. And if you've got a question regarding kids between 6 and 12 and their oral health, I can help you out with that. So ask that. Let me also know where you're coming from. Today I'm coming to you from New York, which is pretty awesome. Here are 3 things you need to know. Number 1, if you're back to school shopping, chances are you're going to be in an area where there's a toothbrush. I know that sounds sarcastic, and I am sorry for sounding that I am sarcastic, but it's true. Okay, so when you're picking up a toothbrush, can you please just, let's say, pick up a couple extra for your kids? What's the point in that? You know, you don't know when you're going to need to throw away a toothbrush. Kids have sleepovers all the time, and so pick up several toothbrushes, preferably soft. Sometimes too, kids, they do better with electric toothbrushes or battery operated toothbrushes. Quite frankly, as long as the bristles are soft and your child is using this, that's important. But here's the other thing to think about with going back to school. So I know you're going shopping, you're going school shopping, you're doing your clothes and everything else, but make sure that you're hooking your kids up with toothbrushes. So when you are out getting them, you know, it doesn't have to be the best, you know, $200 toothbrush. Just make sure that your child is brushing. The whole point is to make sure you're removing the plaque around there, because you know what? They're going to school, they're getting into a routine. And no, I don't have kids, so obviously I'm an authority on this. When they're getting into a routine, that includes brushing. Notice, I did not say brushing and flossing. Here's my philosophy. It's not going to happen, people. It's not. Anybody that I know, of all of my patients, right? It is not gonna happen. Your child's not gonna floss on their own. First of all, dexterity. Let's go over that. Dexterity is not going to be, let's say, adequate to floss. And parents, in order for you to even take time to make sure they brush their teeth, and let alone for me to expect you as a dental hygienist to floss them adequately, it's not going to happen. So I just want to share with you, get something in between. There could be interdental brushes. They're on the market. One of my favorite is Curaprox. You can order that from curaprox.com. You can go to sunstarbutler.com. There are so many really cool things for kids to get in between your teeth. And that's the other thing to think about. It's about getting in between the teeth. Now, okay, so that was number 1. School supplies, obviously get a toothbrush, get interdental brushes for your child so they can work them in between their teeth. The second thing, make a dental exam, and do it now. Do it now. Call your dentist, get an appointment with the dental hygienist. Why? You know what? It's over the summer. Stuff happens, right? So we would just want to make sure that if your child, they needed restorative work done, you know, just make sure that they got that done. You know, I mean, if there's something, if they're at a high caries risk, medium caries risk, or even low, we just want to make sure that everything is fine. So if they are between the ages of 6 and 12, then you might want to just make sure if they've had dental sealants, that the dental sealants are in place. How many times do they just pop off the child's teeth? So the sealant can't prevent decay if it's, you know, let's just say it's popped off or anything like that. Someone did suggest a water pick. All about it. Love a water pick. They're awesome for ortho. Are you kidding me? They're great. Great suggestion. Water pick also makes them for kids. So, you know, check this out. You can get them anywhere. You can also order them online. Love that stuff. Great suggestion. Anybody using anything else for kids that's outside of, let's say, interdental brushes or water picks? Come on, write it down. First of all, where's everybody coming to you from? I'm coming from New York. Hygienist of 27 years. Those of you who don't know me, Anastasia is the name, at Anastasia RDH. Please check out the website, AnastasiaTurchetta.com, if you need somebody, you know, to ask some questions to about your kids as far as their oral health. Speaking to groups, I can help you out with that. So, yay, Canada, welcome. You're not too far across from me. I'm in Buffalo, New York right now. All right, so we talked about back to school supplies, okay? So make sure you get your child a toothbrush, toothpaste, interdental brushes, water picks, whatever you can get to keep everything clean. Second thing, make an appointment with your dental hygienist. Now third, because I like to keep this short. I mean, seriously, Periscope is awesome. I'm loving all the hearts. But let's get real. You don't have time to listen to oral health tips, right? So let's just keep this real. Third thing, your child's going back to school. So if it's between the ages of 6 and 12, they could be in sports. If they're in sports, you might need a sports guard or a mouth guard. And I would definitely recommend that you get that made custom, and that is at your dental office. I know they have the boil and bites, and that's better than nothing because at least it's protection. But you know what? We've got kids between the ages 6 and 12. They're going through ortho or braces. Maybe their teeth, you know, they're coming in, they're coming out. It's just better to see something that's going to last them better. And your dental office works with dental labs that make these mouthpieces where it protects your kids, no matter what their sport is. But you know, when you're going back to school, this is stuff that you don't think about. I could go on and on, but this is the first Periscope that I've done, and I just hope everybody got to learn, especially parents who did not know. All right, why? What's so important about me getting my child back to school and understanding the importance of oral health? When you're missing 2.4, let me look at that stat again. Let's just see here, because that was a lot of stuff, right? 2.6 million days. Are you kidding me? 2.6 million days of school are missed due to dental pain. And it shouldn't be that way. It shouldn't be that way. Not in America. So there are programs out there. If you can't afford it, it's amazing. You know, parents, we just need you to get the kids into those dental offices. The reason being, they can't drive themselves. So isn't it time to break the cycle? We've got so much stuff to help kids out with. Let's break the cycle, okay? I mean, it's just amazing to me how we have parents. Thank you for that encouragement. I so appreciate that. It's awesome. You know, many times too, parents don't know if we take Medicaid, if we don't take Medicaid. You can call the offices, and many states do have programs in place. You know, break that cycle. Even if you didn't go as a kid, that's okay. But your child doesn't have a choice, and your child will have teeth, and those teeth are going to last them. It's important to take care of them. It helps them with speech. It helps them with them to eat. It helps them keep their focus when they're not in pain in dental school. There are studies on that. I could get you the stats. But, you know, keep in mind, it's really important for them to value their smile. Your health really is linked to your smile. So if something's wrong, 2.6 million school days a year that are missed with dental pain, think about it. You know, your child deserves more than that, and we've got the programs there here in the United States. So obviously, back to school, get the toothbrushes, battery operated, that's fine. They're about $20, $30. I'm thinking, anybody out there that knows? I haven't been to look. I think it's you know, they've got Colgate and Crest spin brushes, different things like that. Shout out to me. What do you got? What kind of toothbrushes you got? What are you using for your child? What's your child like? We had different types of interdental, so you don't have to use just floss. So that could be water picks, it could be interdental brushes, Curaprox, doesn't matter. Give me a shout out. What do we got here? So, you know, I think this is going, I'm just impressed. I see the little hearts. I just want to thank you. Sonicare, rock it out with Sonicare. You know what? I know this with Sonicare toothbrushes for the kids. It helps get them up to 2 minutes. So in actuality, you know, your child may not think 2 minutes, that's a long time. I mean, come on, really? It's a long time for adults. But Sonicare's latest edition with toothbrushes for the kids, it kind of I don't know, it's almost like training. So it starts them out 30 seconds to a minute. That might be something to check out. Water pick people. I got water pick people in the house. Check it out for your kids. Obviously, for in between, especially for ortho. Really, really big. Ortho or braces. Again, hey, if you're just joining me, I'm Anastasia Turchetta, America's dental hygienist. Oh, great suggestion. Question was about microbeads. What are microbeads? Let me just try and get this straight here. Microbeads are the little blue pellets, and yeah, they're plastic pellets. They're in the toothpaste, and they should stop making this by I'd say the end of this year. But you can find them, probably still can find them at dollar stores or different things like that. Here's what we know. they get lodged in between your teeth and underneath your gums. And I do know this to be true. This has nothing to do with the kids, but it's hard to get them out, especially if you have pockets or gum disease. So you know what? Stop using those, okay? If you have anything that's got little microbeads on it, stop it. Throw it away. You could take it back to where you got it. Good luck with that. That's all I gotta say. Sometimes it doesn't really work, but throw it away. Do not, just make sure you look. Don't use anything with the microbeads in it, because I'm gonna tell you what, as a hygienist, I've seen these blue little pellet things, and I don't even know who made that. Whose idea was it? Hey, let's get a bunch of pellets together, and it's cosmetic, but somehow it's gonna remove plaque. It doesn't do crap, okay? I'm surprised at the success of that. So anyway, you're doing that. Don't do it. Don't buy it. Please make sure you throw that away. Also with the kids, make sure you throw that away. You know, there's just, it's amazing to me. So, hey, thanks. Oh, wow. Great suggestion here. I love this interaction. Thank you. Yeah, so you want to make sure that you're looking out for that. Again, they're still going to be on the shelves. So if you're going to the Dollar Tree or Dollar Store or whatever that is, or you're looking, Crest is the one with the products. And I believe there was a website. So if you probably Google all of the micro beads in the toothpaste, I will bet you'll find it, and you will see who carries it, so you don't go there and don't purchase it. It is not good for the environment, first of all, and it's not good for, obviously, our gums and health. I did a YouTube version on that, so if you wanted to Google that too, YouTube channel is Anastasia RDH. And again, if you're just joining me, we're going over 3 things why parents need to pay attention for back to school stuff. Come on, here's the deal. We need to make sure they have toothbrushes, right? Right. And you want to make sure you get a couple of them. So when you're going to back to school supplies, get them, use them. Make sure that your kids are using them at least twice a day. I would prefer 3, but I know it's asking a lot, right? It's asking a lot of questions, or a lot of a parent. Because me, not being a parent, I know that's really taking some time out of it, right? So you want to make sure that you're buying them. You want to make sure that you make an appointment with the hygienist, because we check the oral hygiene. We're going to go over nutrition with you. We're going to see, you know what is a good product for your child? And your hygienist should also tell you, is your child at a moderate or high risk for caries? Do they need dental sealants? How are the dental sealants holding up? And here's the other thing too, parents, you know what? Even if you have anxiety, think about this. Please don't pass it on to your child. We really do want to make a great experience for your child, and we want to make it fun for them. Count their teeth, make sure they're doing a great job. And you know, it's about health, it's about prevention, right? So know that even if you don't have dental insurance, there are programs out there. Please help us break the cycle in America. I can't stress that enough, okay? So then obviously the third thing, I'm into the sports, so make sure that your child's got a sports guard. And it doesn't matter if they're taking taekwondo, they're playing soccer, football, it doesn't even matter, you know, between the ages of 6 and 12, please help them out. So look, I hope this helps you out. Thank you for joining me. Please, I want to see some hearts. Share this mess. I want to see it and come on to this more. And as I tell everyone, till next time, take what you learn and make a difference with it.